We are the future physician leaders from the University of California, Riverside. The heart is among one of the most vital organs in your body, and in this video, we hope to raise awareness about congestive heart failure and motivate you to do your part and care for your heart. This video is intended for general information only. For medical advice, please seek out direct consultation from a medical provider.
Did you know that congestive heart failure affects 6.2 million Americans over the age of 20? That's right, over the age of 20. If we are looking at the Inland Empire alone, approximately 1 of every 3 people with heart disease also have congestive heart failure. The IE is responsible for 10.75% of all California heart failure hospitalizations.
So what is congestive heart failure? Broadly speaking, it is one of the several types of heart diseases. More specifically, congestive heart failure, also known as CHF, is a condition where the heart doesn't pump blood as well as it should. The heart is like a pump that circulates nutrient-rich blood throughout the body when it functions properly. In a healthy heart, the amount of blood flow into the heart is equal to the amount of blood flow out of the heart. On the other hand, a weak heart cannot pump blood out at the same rate it is receiving it. As a result, blood backs up in your veins and fluid buildup results in swelling. The swelling can occur in the legs, the lungs, or other parts of the body. When your doctor says the word edema, they are talking about the accumulation of fluid that we see here.
Since there is an increase of fluid buildup in the body's tissue, the tissue swells, causing the swelling we see in the legs and feet, also known as edema. The fluid buildup in the lungs can cause respiratory difficulties such as shortness of breath, coughing, and wheezing. Additionally, since the heart pumps blood to essential organs first, less blood is pumped to the rest of the body, causing increased fatigue and loss of appetite. Digestion isn't the body's first priority when it is in congestive heart failure. So who is susceptible to develop heart failure? There are some individuals who are at higher risk of developing heart failure due to pre-existing health conditions such as coronary artery disease, high blood pressure, high cholesterol, or diabetes. Low physical activity, obesity, and a poor diet also greatly contribute to developing heart failure. While these risk factors have a potential to lead to CHF, there are a few changes you can make in your lifestyle to give yourself the best chance of preventing heart failure. You can begin by heavily avoiding alcohol, drugs, and smoking. You should limit or manage your stress, and it is important to follow a balanced diet, exercise regularly, and maintain a healthy weight.
While heart failure is a serious condition, it is not fatal if treated properly. Let's take a look at the 3 things we can do to treat CHF. There's diet, exercise, and medications. Let's start with diet. Although we know salt makes our food delicious, we need to limit our salt intake. We also need to stay active. The best way to do this is starting with daily walks. Make sure to exercise based on the recommendations by your physician. Some people with heart failure have different exercise limits and conditions depending on how advanced their heart failure is. Ultimately, you can take medications to help your body in the way that it needs. Diuretics, better known as water pills, help the body remove excess fluid. Anticoagulants prevent blood clotting. Vasodilators lower blood pressure. And beta blockers and ACE inhibitors improve heart function.
We have included various QR codes where you will find more information on CHF and local support available to you. One can live a long and happy life with CHF. However, our goal is to reduce the number of individuals who reach such a diagnosis. It is important to take care of our health and heart to prevent the development of heart failure. You only have one. Do your part and care for your heart.
Well, thank you for watching our video, and we hope this raises awareness about congestive heart failure. If you have any questions, feel free to follow us on social media.
Lastly, we want to give credit to our team for gathering this information and putting together the presentation. The content and information in this presentation was compiled through publicly available data and reports found on screen.